In a recent interview, former President George Bush seemed to favor his right knee as he walked. For years, in fact, back to 2003, he was diagnosed then with runner's knee, having a ligament tear and soft cartilage. Now NBC5 is the first to report that he underwent partial knee replacement at Rush Medical Center in Chicago. It was done Saturday over the holiday weekend to not attract attention. Even the nurses didn't know who the patient was until that morning. Rather than overnight at the hospital, the 43rd president spent 2 nights at the Peninsula Hotel. While not his doctor, Dr. Matthew Beal from Northwestern Medicine says the surgery is quite common.
It only takes about an hour to do a partial. A lot of it, there's different ways that you can make custom jigs and different things ahead of time to actually make the knee replacement go a little quicker.
The former president had a stent placed in his heart last August. He's always been quite active, known for exercising. The team that performed the surgery at Midwest Orthopedics at Rush included Dr. Richard Berger, who, according to the hospital's website, is the pioneer of minimally invasive knee surgery.
That allows our patients to have the surgery with much less pain and, in fact, almost pain-free.
The former president's spokesman says he was up and down stairs just a couple of hours after the procedure.
Yeah, most patients will say, I wish I would have done this 10 years ago, and that's usually the case across the board. Appropriate patient selection. We try and get them as old as they can be, but I'll tell you that the patient population these days, for a partial in particular, is getting younger and younger and younger.
Doctors followed up with Mr. Bush at the Peninsula Hotel, where he was seen both in a wheelchair and walking before he left Chicago to return to Dallas Monday morning.